My name is Anurag Gupta and I am pursuing Bachelor of Pharmacy from Haji Institute of Pharmaceutical Education and Research, Lucknow. Now I am presenting a topic which is based on ischemic heart disease. So let's begin the topic. Before discussing the topic, now we see the outline of presentation. So outline of presentation comprises definition, etiology, pathophysiology, sign and symptoms, diagnosis, treatment and complication. So let's go on the definition of ischemic heart disease. So definition of ischemic heart disease is a condition which occurs when the major blood vessels supplying blood, nutrients, oxygen to the heart become damaged or diseased. Is termed as ischemic heart disease or chronic heart disease. So this is the definition of ischemic heart disease. And now we move to the etiology or causative agent of ischemic heart disease. So the buildup of plaque in artery and inflammation are the major cause of coronary artery disease, and other factors are smoking, high blood pressure, high cholesterol, diabetes or insulin resistance, inadequate lifestyle. So these are the causative agent of ischemic heart disease. Now we see the pathophysiology of ischemic heart disease. So let's see the how its pathophysiology. So pathophysiology of ischemic heart disease are coronary artery thrombosis and coronary artery vasospasm occur due to deposition of plaque into blood vessel and break down the plaque vasospastic mediator. As the least cause platelets aggregate, which cause damage to the blood vessel and not supply blood, oxygen and nutrient to the heart. So due to which ischemic heart disease are caused. So this is the pathophysiology of ischemic heart disease. Now we see what are the signs and symptoms of ischemic heart disease. So signs and symptoms are angina pectoris in cold weather or emotional situation, acute chest pain, myocardial infarction or heart attack, or heart failure causing to difficulty in breathing, weakness of heart muscle. So these are the signs and symptoms by which you can know that a person is suffering from ischemic heart disease. So now we move to the next section, which is diagnosis. In diagnosis section we see electrocardiogram, MRA, echocardiogram, coronary angiosperm, which are electrocardiogram, it measures the electrical impulses of the blood. MRA, magnetic resonance angiogram, which is it diagnoses the blocked arteries. And next echocardiogram, it produces image of heart. Next one, coronary angiogram, which is it is used a dye and observe its flow through the artery to highlight narrowing and blockage. So these are the way to diagnose the ischemic heart disease. Now we go to the next section, which is treatment. It basically involves three types of treatment. First is lifestyle changes, second is using drug therapy, third is surgical procedure. In the lifestyle changes, patients should do quiet smoking, healthy diet, regular exercise. In the drug therapy, there are many drugs used to treat the ischemic heart disease. These are the angiotensin receptor blocker to relax the blood vessels and reduce blood pressure, angiotensin converting enzyme inhibitor, anti-plaque drug to prevent the formation of blood clots in blood vessel, B blocker to reduce the heart rate, calcium channel blocker to reduce workload on the heart muscle. Next is nitrator to dilate the blood vessel. Next is surgical procedure, which is basically involve angioplasty and stent placement for removing plaque and restoring blood flow in the blocker artery. And next is coronary artery bypass graft, which is used for restoring blood flow to the heart by routing the flow through transplanted artery. So these are the way to treat the patient who have ischemic heart disease. So now we move to next section, which is complication. So in ischemic heart disease, angina, which is chest pain, heart attack, heart failure, abnormal heart rhythm, arrhythmia occur. These are the complications which occur in ischemic heart disease. So, in ischemic heart disease, major blood vessels of the heart become damaged, which supply oxygen, blood, nutrient to the heart. It's caused due to high blood pressure, high cholesterol, inadequate lifestyle, building of plaque, and inflammation in artery.